You are watching the Doctalk Show.
This message is from the Ministry of Health with support from partners.
Hello and welcome to the Doctalk Show. My name is Dr. Kamara Ivan. As the world marks World Hepatitis Day on the 28th of July, we are joining the conversation to discuss hepatitis, a disease that affects more than 300 million people globally. Joining me to discuss hepatitis is Dr. Henry and Dr. Alex. This show is sponsored by the Ministry of Health and Cameline Men's Collection. Dr. Henry and Dr. Alex, welcome to the show.
Thank you. Thank you very much, Dr. Kamala. Good evening, our beloved viewers, and thank you for coming to Doctalk Show. I hope you'll be able to learn something from our show today. Thank you very much.
Welcome, our beloved viewers, to the Doctalk Show. My name is Dr. Alex Bwesabula. Thank you.
Welcome, Henry and Alex. So let's start straight away by understanding. So what is hepatitis?
Basically, hepatitis, when we talk about hepat, we're referring to the liver of a human being. And then when we talk about itis, we are talking about a response, the way the body responds to maybe injury or any kind of infection. So if you combine the two, that's when you come up with the word hepatitis. So in hepatitis, the liver is trying to respond to maybe an injury or an infection. But in the due process, you find that the liver cells, or the cells that make up the liver, what we call the hepatocytes, are now injured. So basically, that is hepatitis in general. When you look at the liver, it's an organ of the human body, which is just below the diaphragm. Now, the diaphragm is the structure that separates the thorax from the abdomen. So that structure that separates the thorax from the abdomen has the liver put just below it. This gland is much more on the right side. The biggest part of it is on the right side, but we have a small portion. So there are two lobes. The bigger lobe is on the right side, and then we have a smaller lobe on the left side. This gland is weighing about 1.5 grams to 2 grams in an average 70 kilogram person. And it does so many functions, as we shall talk about them in detail. But basically, that's what hepatitis is, and the liver in general.
Yes. So hepatitis is essentially inflammation of the liver. It's a condition of the liver. So hepatitis can be due to either an infection, toxins, or a derangement in the metabolites, right? So that is what hepatitis is. But let's look also at the functions of the liver. Dr. Henry, what are the functions of the liver in the human body?
Okay, thank you very much, Dr. Kamala. Now, the liver has very, very many functions. For starters, it's one of the vital organs that we have in the body, and it has quite a number of functions, which if it's impaired, like we shall see maybe in hepatitis and advanced diseases or complications of liver disease, some of these functions will not be performed because the liver doesn't function very well. So one of the biggest functions of the liver is it helps with metabolism. You realize that after food has been eaten and it has been digested and absorbed, it enters blood, but all that all those components that have been absorbed will pass through the liver. So some of these components will include things like glucose, amino acids, fats, and it's upon the liver to pick out these. First of all, it does the filtration. It filters some of these and removes some of the toxins. But then some of those other components, like the glucose, it can store them into a form that the body can use later on. So there's a form what we call a glycogen. So some of the excess glucose is going to be converted into glycogen. And later on, maybe if the body is in need of energy, for instance, somebody is starved, some of this glycogen can be broken back into glucose and the body uses it. So in that way, the liver helps with metabolism. Same applies with amino acids that come from protein digestion. The liver also plays a very big part in the metabolism of these amino acids. Also the fats, cholesterol and triglycerides. The liver has the ability to convert some of these components into other forms that the body can use at an appropriate time. But that said, the liver also has a role that it plays in digestion. There's a component, there's what you call bile. So bile is a fluid that helps in the fat digestion as well as the absorption. So this bile is actually produced in the liver and then it's stored in the gallbladder. So when you take, for instance, a fatty meal, this bile has to be utilized in the process of breaking down this fatty meal so that the body can be able to absorb it. So primarily the whole function of producing this bile is a function of the liver. Apart from that, the liver also has some role in immunity. It has cells which are called Kupffer cells, and now these cells are important in identifying some of the foreign agents, some of the foreign microorganisms that could be disastrous to the body, and remove them into the system. The liver has a synthetic role. It manufactures things. It manufactures proteins. I'll mention, for instance, a protein called albumin, which is very important in our bodies. It helps us in keeping our body fluids, and it's a very important part of the blood. So it's the role of the liver to make this protein and make sure it's available. The liver also has a role in the metabolism of hormones. What I mean by this is that after you've produced your hormones, first the body has produced some hormones. Some of these hormones work for a certain time and then they have to be removed. So some of the hormones are actually removed by the liver so that their effects don't stay for so long. The liver also has a role in detoxification of the different things that we take in the body. I'll give you an example. We take medication, so every day these medications are sometimes they're definitely foreign to the body, and the body has to get a way of making them less toxic and also excrete them. So the liver plays a very, very big function in this. The functions of the liver are very many. Okay, it even stores some of the vitamins. It helps in the synthesis of some vitamins and so many. So in summary, the liver has very, very many roles, and these roles can be impaired in case of disease like hepatitis or maybe some other complications of the liver disease. Yes.
Yes, so most of us may be familiar with the role of the liver, where it removes toxins from the body. But as we can see, the liver has so many other important roles in the body. It plays key roles in immunity, in coagulation,
Yes.
and in metabolism. So now that we've looked at the functions of the liver, they may not be very easy for our audience to understand, but what's important to note is that the liver is one of the important organs in the body, and hence why when it fails, it is quite disastrous. If your liver fails, you may actually end up dying. So now we're going to look at hepatitis. So there are 5 main types of hepatitis: hepatitis A, B, C, D, and E. However, the ones that are of more public health importance are hepatitis A, B, and C, and most especially hepatitis B and C. So, Dr. Alex, you're going to tell us a bit more about hepatitis B and hepatitis C.
We've seen so many public health interventions that are coming to see how best we can curb these conditions, because at times we may not know how much they affect people around the globe. World Health Organization estimates that around 250 people have hepatitis B, and around 50 million people have hepatitis C. So in total, you see that you have now around 300 million people affected by only hepatitis B and hepatitis C. Yet we know that there are even other types of hepatitis. And around 1.3 million people die globally every year due to hepatitis, major hepatitis B and hepatitis C, as you said. But it's hepatitis B that is much more deadly and much more disastrous, because of the 1.3, it kills about 1.1 million people alone. So the reason I was trying to tell these people these figures, so that people know that tomorrow I can contribute to that statistic, so that we empower them with how best to prevent themselves from getting this disease. These diseases, hepatitis B and hepatitis C, are majorly in low and middle income countries, because these countries usually have poor access to health care. People usually live or have risky behaviors, and as well because of the quality of life that people live. As we shall see in time to come, that these diseases usually come or are spread, some of them, or some form of hepatitis are spread when we take maybe dirty water or something, or when we drink dirty water or eat dirty food. That means that areas where you expect people to be living in such conditions are much more likely to get hepatitis. And in Uganda alone, around 4.5 million people have chronic hepatitis B, and around 1.5 million people have chronic hepatitis C. So that's how big, or that's how common these conditions are, and that's of course calls for interventions or people to be empowered so that they prevent, and as well if they get the disease they seek attention.
So when we refer to hepatitis, we are normally referring to hepatitis B and C, which are caused by virus. These are viral infections. And then we also have hepatitis, remember, that can be as a result of toxins. One of the most common toxins is paracetamol, a common drug that we use, but we shall get into the different causes of hepatitis. Right now we are going to take a break, and when we come back we shall look at the different causes of hepatitis.
This message is from the Ministry of Health with support from partners.
Since 2015, Quiz Mali Production has been at the forefront of media innovation. Our passion for storytelling and creativity has driven us to deliver over 100 successful projects, making a lasting impact on the industry. With 4 highly acclaimed TV shows, we've become a household name, bringing quality content to your screens. At Quiz Mali Production, we specialize in content creation, digital media marketing, media buying and documentaries. We plan corporate events, provide top-notch photography and videography services, and offer seamless translations and live streams for your every need. Join the hundreds of satisfied clients who trust us to bring their visions to life. Quiz Mali Production, your partner in media excellence. Visit us at Quiz Mali and let's create something amazing together.
You are watching the Doctalk Show.
This message is from the Ministry of Health with support from partners.
Hello and welcome back to the Doctalk Show. My name is Dr. Kamara Ivan, and today we are discussing hepatitis. As the world marks World Hepatitis Day on the 28th of July, we are joining this conversation to discuss hepatitis. Hepatitis is a disease of the liver that's a silent invader but with serious complications. So, hepatitis has several causes. Hepatitis can be caused by viral infections, it can be caused by toxins, or it can be caused by a derangement in metabolites. So, Dr. Henry, take us more into the causes of hepatitis.
Okay. Thank you very much, Dr. Ivan. Now, like we earlier on mentioned, that there are quite a number of viral agents, and like we've said that hepatitis A, B, C, D up to E. But the commonest that are of public health importance in our setting is hepatitis B and C. And as a matter of fact, the hepatitis A and E, which are spread through means that we shall look at later on, they don't even have that chronic phase. So what we mean by chronic is that when we're classifying this hepatitis, there's what we call acute and chronic. Usually acute, whenever you hear it, it means it's a short time, it has happened in a short time. So patients can have hepatitis first, and it resolves. It's self-limiting. Okay, especially hepatitis A, hepatitis E. A patient can actually have it, and within 6 months it's gone. So there are types of viruses, that's hepatitis A and E, that only give you that acute picture. They don't become chronic. However, hepatitis B and C, for them, they can actually become chronic. So somebody can have it, 6 months elapse, and they still have it. The body fails to clear it, and they even progress into what we call chronic. So even in the classification itself, we have what we call acute and a chronic. But I need our viewers to know that hepatitis A, hepatitis E, usually patients can have it just in the acute phase. It doesn't get chronic, but for B and C, they even get chronic. But apart from those viruses, there are quite a number of other things which could cause hepatitis.
Wait, let's before we go on to other causes of hepatitis, so let's clarify on the viruses. So hepatitis B and C, hepatitis B virus and hepatitis C virus are the viruses of importance when it comes to hepatitis. So hepatitis B virus, if you get infected with hepatitis B virus, the virus can get into your body and remain for a long time. That's what you mean by chronic.
Yes.
So it can remain within the body for a very long time and progress to the point where it destroys your liver.
Yes.
And for hepatitis B, this can happen even more when a person is still below the age of 5 years. And that's why in our national immunization schedule, we have a hepatitis B virus vaccine now included in the national schedule. So I wanted to highlight to the audience about hepatitis B, why it is of importance to us, and why it and that is the reason why it is included in our national immunization schedule. So hepatitis can be caused by things other than viruses as well. So what other things can cause hepatitis?
Thank you very much. So there are toxins, there are quite a number of toxins that can actually cause hepatitis. Some of these are naturally occurring toxins. I'll give you an example of aflatoxins. You must have heard that even some foods, even in our settings here, where the aflatoxins, and actually they could have an effect. But apart from those natural toxins, they also are artificially made toxins, including the drugs that we take. So some of the medication that we take, especially for a long time, some of them could actually get somebody into getting hepatitis. But apart from that, things like alcohol, for people who take alcohol and excessive amounts of alcohol for a long period of time, we have what we call alcoholic hepatitis. And alcohol is one of the things that actually damages the liver badly, that it could even get much more complicated. So people who take excessive amounts of alcohol for a long period of time, they could actually get alcoholic hepatitis. Then apart from that, there are things that are within our surroundings or within our homes that we take, but we don't know that actually could get us into hepatitis. I'll mention an example of herbal drugs. There are many patients out there who take a lot of herbal drugs to manage their illnesses. And this is not maybe a discouragement against herbs, but I need our viewers to understand that these herbs, most of the times, we don't have doses. We don't know the actual doses that we should take. Sometimes even if they tell you that you can take maybe a cup or maybe take 2 spoons, but you cannot quantify how much of the drug is in that. And sometimes we take some other impurities that actually don't need. So we've seen quite a number of patients who come to us and they have taken these herbs and now the liver is affected, because it's a function of the liver to filter these and make sure that all is well. So I think like herbal medications could actually get us into hepatitis, alcohol, as well as the viruses. Yes.
Yes. So we have certain toxins that can cause hepatitis as well. And for our audience, most importantly to note is that paracetamol is a very common drug that we use. So we have to be cautious when we are dosing paracetamol. And if you're on drugs for a long period of time, if you're on any medication that you have to take over months and over years and it contains paracetamol, that's something that you might want to look out for. Or sometimes we have a common habit of self-medicating children. Children who get fever, we often go and we buy them paracetamol syrups. So this one, you have to be really cautious that you follow the exact dose so that you do not overdose. Yeah, so paracetamol is one important toxin when it comes to the liver. For us, in emergency medicine, which is more of my area where I practice, that's one of the things we look out for. If someone comes with liver failure, so we look into paracetamol poisoning. Or if someone comes with having taken a paracetamol overdose, for instance, in an attempt to commit suicide, we are quite concerned with liver damage.
Okay.
Yes, and
actually, there's some medication that can be given to try and reverse that. And that's why our viewers should know that if they have such a case, they need to rush to hospital, because the earlier they go, the better. If you delay, of course, the body will absorb it and it becomes difficult to reverse this. So if somebody has had this paracetamol toxicity, they have taken too much, the earlier you take them to hospital so that they get this medication, the better.
Yes, so fortunately, there is an antidote for paracetamol poisoning or paracetamol overdose. And as Henry also mentioned, herbal remedies. We tend to look at herbal remedies as quite harmless, but we need to note that they are also not completely harmless. If you're not sure what herb exactly that you're taking, or you're not sure of the quantity of that herb in the formulation you're taking, it can also lead to hepatitis. Now, when we are talking about hepatitis, we also have, we looked at the viral hepatitis, yes, A, B, and C, specifically B and C. we need to talk about the transmission. So how are these hepatitis illnesses spread? Dr. Alex can take us through that. How is hepatitis spread?
Thank you so much for that question. These viruses are basically spread in two ways. The first way is the vertical kind of transmission, whereby a mother gives the virus to the unborn child, so that by the child is born, they already have hepatitis, so they have the virus that causes hepatitis, and that's what we refer to as vertical transmission. You might have heard that usually in antenatal care, we always screen for hepatitis B. We screen these mothers for hepatitis B so that we find out whether they have hepatitis B virus infection or not, so that we can help to prevent the transmission of hepatitis B from the mother to the child. Then besides vertical transmission, there is also horizontal transmission, whereby in horizontal transmission you look at fecal oral, whereby I mean that maybe someone had the virus in the intestines, they defecated it, for example, in a water body, and people drank this unboiled water and they are at risk. Especially when we look at hepatitis A and hepatitis E, most of the times those are transmitted fecal orally. So that requires people who are always keep at the Doctalk show and everyone that can receive this information to always drink boiled water and ensure that you use water from credible sources so that you're not at risk of getting this kind of the viruses that can lead to hepatitis. And then besides that, we also have in horizontal transmission from one person to another. We also have sexual transmission, whereby there are some viruses that are transmitted from one sexual partner to another. If you look at hepatitis B and hepatitis D, they can be transmitted from one sexual partner to another through sexual fluids. And usually we always prefer to have people do premarital counseling, because these are some of the infections that we always screen for. We always screen for hepatitis B, as to ensure that the other partner who doesn't have hepatitis B doesn't get this hepatitis from this person. Then we also have hepatitis B, hepatitis C, and hepatitis D can be transmitted from one person to another through blood contact, and that puts people who use IV injection, people who inject themselves with drugs, because some of them use the same needles. Others at times use blood of one person to mix the drugs, and then the rest use that blood that is mixed with the drugs that they want to inject themselves with. So people who inject themselves with drugs usually are also at risk of getting these viral forms of hepatitis that move from one person to another through blood, and that is hepatitis B, C, and D.
Okay, so one thing to remember is that hepatitis B is transmitted in a similar way as HIV. So it's easy to remember it like that. So in the same ways that HIV is transmitted, hepatitis B can also be transmitted. That is, it can be transmitted sexually through blood products, blood transfusion, and infected needles. And then hepatitis A is transmitted in a similar way to diarrheal diseases. So the same way you prevent diarrheal diseases, that's the same way that you can prevent being infected with hepatitis A. So we've looked at the methods of transmission of the hepatitis viruses, the viruses that cause hepatitis. And when we come back, we are going to look at the signs and symptoms of hepatitis. How do you tell that you have hepatitis? And what exactly does hepatitis do to your body? What are the complications of hepatitis? So we are going for a short break. Thank you for watching the Doctalk show. When we come back, we shall continue talking about hepatitis.
You are watching the Doctalk show.
This message is from the Ministry of Health with support from partners.
You are watching the Doctalk show.
This message is from the Ministry of Health with support from partners.
Hello and welcome back to the Doctalk show. My name is Dr. Kamara Ivan, and in this episode we are discussing hepatitis. Hepatitis is a condition of the liver that invades silently but has serious complications. And before we went for a break, we were talking about the different types of hepatitis, the different causes of hepatitis, and now we are going to look at the signs and symptoms of hepatitis. So, Dr. Alex, how can someone tell that they have hepatitis?
Thank you so much, Dr. Kamara, for that question. Like Dr. Sachan said before, that hepatitis can be self-limiting. There are people that get hepatitis, they don't get the signs or the symptoms of hepatitis, and it clears on its own. And then, as you said, that this hepatitis can be either acute or chronic, whereby if it is acute, that is below 6 months from the time of onset. And then for the chronic, that is after or more than 6 months from the time of onset. So for the acute hepatitis, usually, these symptoms progress differently depending on the rate of progress of disease or the rate of destruction of the liver cells, how frequently or how speedily the liver cells are being destroyed. So for the acute hepatitis, usually we see patients having right upper quadrant pain. Like we said, that the liver, which is the organ that is affected, is in the upper abdomen. So usually people that have hepatitis have long-standing upper abdominal pain, much more on the right, but a little bit on the left, where the liver is located. We said that the liver is very crucial in digestion of fats. So if someone has hepatitis, that means that they have issues with digestion of fats. And remember, these fats, usually, if they are not digested, they will, someone will pass them out in feces or in fecal matter. So you end up having diarrhea, or what we call steatorrhea, whereby the food is fatty, if I can put it like that, because of the defects in fat digestion and absorption.
Actually, Dr. Alex, usually those patients, when they go to toilet and they try to flush, they will flush and sometimes their stool doesn't go
It doesn't,
because the stool contains a lot of
fats
fat,
which are a bit light, so it doesn't go on flushing. And then Dr. Sachan has talked about elimination of toxins from the body. So if you have toxins in the body, they have effects that they bring to you. They have effects that they make, how they make you feel. There are people that feel fatigue all the time. All the time you feel tired, you do something very small and you're extremely tired because of the buildup of the toxins in the body. Like we said, the liver is damaged. So the body is trying to fight these viruses that are causing the hepatitis. So people end up having fevers. So these fevers that are long-standing, fevers that are relieve on medications, but still they come back without any effective cause, you could maybe think that this person likely has hepatitis. And then on a chronic phase, if this hepatitis has been there for a long time, there are things that we see how these patients always present, and we find out that maybe they have been having this hepatitis going on for a long period of time. Like we said, you have this liver that is very helpful in removal of toxins. The liver is damaged, toxins are building up in the body. So if these toxins are building up in the body, they will end up affecting the brain or the brain cells and their functioning. So you end up having people get what they call hepatic encephalopathy, where they have derangements in their thinking, derangements in all the functions of the brain, memory and everything in that regard. So hepatic encephalopathy is whereby you have hepatitis coming in, and this hepatitis ends up affecting the brain, and so you have, because of the toxins that are building up in the blood, and then this brain also gets up these toxins, and you have the brain cells damaged in that regard. So people always feel drowsy. Most of the times they are confused. In rare cases, they even lose memory. They become disoriented because of the hepatitis. The liver is completely damaged. We talked about the role of the liver in production of bile. But as well, after producing this bile, it is this liver that also breaks it down and eliminates it from the body. This bile is what helps in fat digestion. So I have fat digestion not taking place. We have diarrhea, or what we call steatorrhea in the start. But as well, the bile is building up. So if this bile builds up in blood, usually this bile will build up in blood to very high amounts, and at the end, this body will try to eliminate it in its own ways. And how does it eliminate it? It always puts it under the skin. So these bile salts, as you feel them a bit sour, if you maybe slaughtering chicken and that bile, kind of bursts out, that kind of sourness that you feel, so it burns the skin at the end. So you end up having someone, their skin itching all the time. So itchy skin maybe could also tell us that maybe someone has hepatitis. Then we also talked about the removal of metabolites from blood. And one of the metabolites that we talk about always is bilirubin. You know, when the red blood cells have worked for around 3 months, they are always broken down. And as they're broken down, one of the things that we always get is bilirubin. So this bilirubin is supposed to be removed from the body. But if it is not removed, it stays in blood. And if it stays in blood, it builds up. When it builds up, you end up having people yellowing, especially in the eyes and on the extremities, the fingernails. You can find some people having all their skin is all yellow because they have this bilirubin that has built up from the red blood cells that we are broken down. And something to take note of is the stools that we always form. Like we said, the stool is coming from the gastrointestinal tract, but as well as it comes, the liver also produces some components into the stool that come along and they are excreted along with the stool that we will produce. So most of the times we have this stool becoming light, very light colored. So you have it look like clay because you have a lot of those wastes or those materials that are being produced from the broken down of different products coming along with the stool, and then you end up having the poo or the stool that people are producing being very light. And then we talked about the buildup of bilirubin. This bilirubin is not being broken down as it should be, so it will come along with the urine. So you end up having someone giving us very dark colored urine or producing very dark colored urine, and it points out that maybe this person has hepatitis. So usually the presentation is different, like we said, depending on how fast the disease is progressing. But usually how these patients present, we shall know, or we shall have a clue that depending on this symptom and this symptom and this symptom, maybe this person has hepatitis. And then if we talk about if this hepatitis progresses a lot, most of the times it ends up causing what we call portal hypertension, as we shall talk about it maybe later, and patients end up having edema, or the body swells around because the liver is damaged. It is pressing on blood vessels that are taking blood from the lower limbs, so you end up having full blast edema. People swell all over. So those are some of the symptoms and signs that could maybe tell us that this person has hepatitis and maybe liver disease.
Thank you very much, Dr. Alex, for that submission. I just want to add something small, is that not all people who have had hepatitis will progress into these full-blown symptoms. Actually, 80% of the people who get hepatitis just stop at acute phase. They don't progress into the chronic phase.
So it's only 20%.
Yeah, so the other 20% are the one who progress. So in the natural progression of this disease is that at the beginning, yes, you can have this acute hepatitis, but for most of the people, it will be self-limiting. They will heal without even any intervention. Now that 20% that remains, they can progress into chronic hepatitis. And those ones, if they don't have any interventions done, this chronic hepatitis can progress into what we call fibrosis. Now, by fibrosis, we mean the liver forms some scar tissue. So whenever you have inflammation, like Dr. Alex told us that in hepatitis, we have inflammation of the liver. So whenever you have this inflammation, healing happens by fibrosis. So the liver forms scar tissue, and of course, this comes with a lot of complications, and some of the functions of the liver will not be performed, and that partly explains most of the symptoms that we've seen. So when fibrosis happens, some of these symptoms are now going to start appearing, and in some people it can even progress into cancer, what you call hepatocellular carcinoma. So it's more like a spectrum. Anybody can belong anywhere, so that everybody's going to get all these symptoms. But those who get these symptoms, maybe the full-blown one, things like hepatic cancer and cirrhosis, they can actually get this hepatic encephalopathy, where if their thinking is going to be altered, and sometimes they tend to have bad consequences.
Thank you, Dr. Henry and Dr. Alex. So there are lots of, you've mentioned lots of signs and symptoms of hepatitis. And when we mention signs and symptoms, I know we may induce a bit of anxiety in people, but the main symptoms and signs of hepatitis are pain in the upper abdomen, especially on the right side where the liver is, and a yellow, you notice a yellow coloring in the eyes and in the skin, which we call jaundice, or you may notice darkened urine, or stool with a lighter color, and you may also have fatigue. So if you have some of these symptoms, they might point to liver disease. However, we need to emphasize that you can be asymptomatic as well. And asymptomatic means that many of the cases, people do not have any symptoms. So you will be infected with hepatitis B and you don't have any symptoms, or you might have hepatitis secondary or hepatitis due to alcohol intake, frequent alcohol intake, and you don't have any symptoms, or you might have hepatitis which is due to another drug.
It could be toxins,
Yes.
paracetamol overdose.
And you don't have any symptoms.
Mm.
So those are just some of the main symptoms that you may have. But always, when in doubt, of course, you go to the hospital and check. So these are tests that we do routinely. So us as health workers, we know when to test you for hepatitis when you come to the health facilities. So we looked at the signs and symptoms of hepatitis. We are going to take a short break, and when we'll come back, we will look at how hepatitis is treated. What are the treatment options for hepatitis? Can you prevent hepatitis? What are your options for preventing hepatitis? Thank you for watching the Doctalk Show, and do stay with us.
You are watching the Doctalk Show.
This message is from the Ministry of Health with support from partners.
Crafted with precision, designed for brilliance, Supreme Wave pens reach the hands that shape tomorrow. Only a Supreme Wave delivers expression this pure. In every stroke, confidence flows. Because greatness isn't guessed, it's written. Supreme Wave, write your future.
Supreme Wave are the best.
You are watching the Doctalk Show.
This message is from the Ministry of Health with support from partners.
Hello and welcome back to the Doctalk Show. My name is Dr. Kamara Ivan, and in this episode we are discussing hepatitis, a condition of the liver. So we've looked at the different causes of hepatitis, and now we are going to look at the diagnosis and treatment of hepatitis. Dr. Henry, so if I go to the hospital, how does the doctor know that I have hepatitis, and what are the treatment options?
Okay. Thank you very much for that question. So doctors will take your history, they will ask you some questions, but most of the questions are going to rotate around these symptoms that we've talked about, things like yellowing of eyes, the color of your stool, the color of your urine, things like feeling fatigued, upper quadrant pain. Doctors will also examine you, in which case they will look out for this liver and see if it's inflamed or if it's bigger than normal or not. Sometimes actually in advanced stages, it could even be smaller. There could be some tests that can be run. Some of these could be blood tests, for instance, to look at these components of the virus. We can look at what we call the antigens. These are components of the virus. And when we find some of these, they can always give us clues on whether the virus is there or not. Sometimes we can look for antibodies. These are proteins that the body produces in defense against these viruses. So sometimes we just look at these antibodies and we can know if we're having an infection or the infection healed, or if you got a vaccination. So there are quite a number of tests which can be done. But apart from that, sometimes we even do some imaging. Things like radiological investigations, for instance, an ultrasound scan. We can do an ultrasound scan, look at your liver. So comprehensively, we do quite a number of things, starting from history taking, examination, investigations, which include lab and imaging. And with those, we can be able to tell if somebody has hepatitis or not. We can be able to tell if somebody has complications from hepatitis, if somebody is in the acute phase, if they are chronic, or if maybe they are having even these other complications like hepatocellular cancer. So after you've made the diagnosis, then we go ahead and treat. So of course the treatment depends on the stage where you are. If someone is in an acute phase, for instance, they're having hepatitis B and they're still in the acute phase, which is below 6 months, we usually don't do anything at it. We just observe and wait, especially if they don't have any symptoms. We just observe and wait, as most of the people even don't progress to that.
If someone has hepatitis due to, let's say, hepatitis B virus, so you're not going to give any medication?
So at that time, when they're still in the acute phase, we don't give medication. We want to wait until the 6 months have elapsed. But as this goes, we keep observing our patients and see How are they getting the symptoms? Are the symptoms getting worse? So that we intervene in. But principles put it that simply because most of the people don't even progress to the chronic, we don't rush into the medication.
Yes, so our body's immune system
Yes.
can fight off the illness.
Yes, yes.
So we always wait and give the body a chance to fight off the illness. And only when it gets to a certain length of time and the illness has not yet gone, that's when we can give the patient antiviral medications.
Exactly. Then when you confirm that actually somebody has now progressed into the chronic phase of hepatitis, there are interventions that we make. There are some medications which we shall give you, and these medications, it really takes quite some long time. So doctors will discuss with you the medication depending on whether it's hepatitis B or hepatitis C. The medications are different, so they can always discuss with you on how you're going to take a medication, which we strongly encourage you that to be adherent to, so that you prevent further complications. So basically with those, for hepatitis A and E, now like we said that they don't usually progress to the chronic phase, and usually they're self-limiting, so usually there's not too much that we do for them. So our biggest areas of concern, hepatitis B and C, which depending on the stage, we can always manage accordingly as doctors.
So we have options for diagnosis and treatment. So what about prevention? Is there any way we can prevent hepatitis? Maybe Dr. Alex can take us through the prevention.
Thank you so much, Dr. Kamara. For any disease, I always believe that we shouldn't wait up to when we see the signs and symptoms. It's better to always try to avoid the disease. And if we suspect that maybe we could be having that disease, we always seek for medical attention as early as possible. As per hepatitis is concerned, I want to first of all thank the Ministry of Health of Uganda, because so many interventions are being put across to ensure that the rates of infection and the progress of these infections into hepatitis, full-blown hepatitis, are actually reducing. We are seeing an improvement in the number of or in immunization, both for children and adults, and as well other public health concerns or public health interventions. But back to the methods that we talked about as per how hepatitis is spread. We talked about hepatitis A and E being fecal oral, in that we always get them from drinking dirty water, eating dirty food. So we should always ensure sanitation and hygiene. We live in very clean places, and we always drink boiled water. And then for other forms of hepatitis that are transmitted through blood, we should also ensure that we avoid blood contact, especially when we look at mother to child, especially hepatitis B and hepatitis D. We talked about sexual intercourse, so you should ensure that at least you have one trusted sexual partner. And also we should ensure that we also go for premarital counseling and testing, because hepatitis B and hepatitis C are now rolled out as some of the investigations that we do for couples during premarital counseling, because we say that some of these are actually transmitted through sexual contact from the partner who is hepatitis, who has hepatitis, to a partner who does not have hepatitis. And if you go to the immunization, as we said, recently we used to immunize only adults, but now we are looking at these children as they are getting their immunization doses, their routine immunization doses for polio, for tuberculosis. The ministry has also incorporated immunization against hepatitis into the immunization schedules for children. So usually there is a monovalent that we give in the first 24 hours after birth. The first 24 hours after birth, we give a monovalent, a vaccine against hepatitis, and then in their routine immunization schedules, usually at week 4, at week 10, and week 16, as immunizing them against these other diseases in that pentavalent vaccine. One of the things that we're looking at is the hepatitis B.
So we have a hepatitis B vaccine incorporated into our national immunization schedule.
Yes.
So if you have a child and you follow the immunization schedule fully and properly, then that child will have protection against hepatitis B
yes,
virus infection.
And then for the adults, I first of all want to thank some organizations that have taken the mantle to immunize the masses, all the people of Uganda, against hepatitis B. So many are coming on board with free vaccines, giving all the 3 doses to people, so that we really prevent them from getting hepatitis. So these doses, they are always 3 in number. So we immunize you for the very first time, and then for the second dose, we immunize you 1 month after the first dose. And then for the third dose, we immunize you 6 months after the first dose. So we immunize you at 0, at 1, and then at 6 months. So all these initiatives are aimed to ensure that people don't get hepatitis, and we always first test before we immunize, because we want to immunize someone who doesn't have hepatitis. If you already have hepatitis, then you're eligible for management. And then I also advise people that watch us at Doctalk Show to always screen and test for hepatitis. We always advise that adults should at least screen once for hepatitis C, because like we said, it's the second most deadly form of hepatitis. So meaning that people should at least screen it once in their lifetime. You should at least get some time, pass by a facility that is doing the hepatitis C testing and screening, and you go through the hepatitis C testing and screening. And then for the hepatitis B, depending on the risk of exposure, it differs, because there are people that are always at risk. For example, people that are living with HIV, people that have ever injected themselves with drugs, or the IV drug users. And then we talked about people that have multiple sexual partners, because you may have a sexual partner who has another sexual partner that has another sexual partner, and in that regard you can easily get hepatitis. So despite observing all these interventions as well, we should ensure that we always do testing and screening for both hepatitis B and hepatitis C.
Okay, thank you. And there's something we haven't mentioned yet, which is also important. We have two risk factors that are associated with hepatitis, which are really common here. I think we have HIV and alcoholism. Those are two important risk factors. So what is a risk factor? Risk factor is something which, when you have it, you increase your chances of acquiring hepatitis. So for us here, we have HIV and alcoholism, which are very big risk factors for acquiring hepatitis, for acquiring the complications of hepatitis. So we've been discussing hepatitis. July 28th is World Hepatitis Day, and we are joining this conversation to highlight hepatitis, which is a silent condition of the liver, however, with very serious complications if you do get it. And I was joined by Dr. Henry and Dr. Alex to discuss this illness, and we do hope that you've learned something about hepatitis, the signs and symptoms of hepatitis, how to prevent it, and at least you do know that we have hepatitis B vaccine in our immunization schedule. So you get protection from hepatitis B if you follow the national immunization schedule. Thank you for joining us.
This message is from the Ministry of Health with support from partners.